Which of the following genetic condition increases risk for development of diabetes? A. Turner syndrome. B. Klinefelter's syndrome. C. Down's syndrome. D. All of these. The answer is D. All of these. All of these symptoms are associated with a higher risk of developing diabetes. Turner syndrome is also known as XO, where the individual is a female, and is monosomic for the X chromosome. Individuals with Turner syndrome are also at higher risk of heart disease, and hypothyroidism, and they are sterile. Down's syndrome is caused by trisomy of chromosome 21, and involves elevated risks for mental impairment, heart disease, and certain cancers. Klinefelter's syndrome patients have the XXY chromosomal expression. They are at a higher risk than the classically male or female public for osteoporosis, hypogonadism, and cardiovascular disorders. What is the most common cause of Cushing's disease? A. Pituitary adenoma. B. Paraneoplastic syndrome. C. Renal adenoma. D. Corticosteroid use. The answer is A. Pituitary adenoma. 80% of cases of Cushing's disease are caused by adrenocorticotropic hormone, ACTH secreting adenomas of the anterior pituitary. High ACTH ends up causes adrenal hyperplasia, which leads to secretion of extra cortisol. Corticosteroid use is the leading cause of Cushing's syndrome, rather than Cushing's disease. How does insulin affect serum electrolytes? A. Insulin increases the permeability of many cells to chlorine, sodium and potassium ions. B. Insulin decreases the permeability of many cells to potassium, magnesium and phosphate ions. C. Insulin has no effect on serum electrolyte levels. D. Insulin increases the permeability of many cells to potassium, magnesium and phosphate ions. The answer is A. Insulin increases the permeability of many cells to potassium, magnesium and phosphate ions. Insulin activates sodium-potassium ATPase in skeletal muscle cells, causing an influx of potassium. Under certain circumstances, an incorrectly administered injection of insulin may kill patients due to its ability to acutely suppress plasma potassium concentrations. What mediates intracellular transport of glucose into the beta cells of the pancreas? A. GLUT4, an insulin-independent glucose transporter. B. GLUT2, an insulin-independent glucose transporter. C. GLUT2, an insulin-dependent glucose transporter. D. GLUT4, an insulin-dependent glucose transporter. The answer is B. GLUT2, an insulin-independent glucose transporter. GLUT2 is the primary carrier for glucose transport into pancreatic beta cells. It does not depend on insulin to function. It thus aids the pancreatic beta cells sense glucose levels in the blood, which are then triggered to release insulin. GLUT4 is active primarily in adipose and muscle tissue. What is the triad of presenting symptoms of diabetes mellitus in adults? A. Polydipsia, weight loss, and enuresis. B. Polyuria, weight loss, and polydipsia. C. Weight gain, enuresis, and polydipsia. D. Polyuria, polydipsia, and polyphagia. The answer is D. Polyuria, polydipsia, and polyphagia. The first onset of diabetes is generally marked by the following three signs: polyuria, frequent urination; polydipsia, increased thirst and fluid intake; and polyphagia, increased appetite. In children with type 1 diabetes, enuresis, involuntary urination, is often the first sign noticed by parents, along with unexplained weight loss and recurrent infections.